Good morning, grade 12s. I hope you managed to do all that work on the section on contraception. It ended up being much longer than I expected it to be. Okay, this is a very short one. So it is also not overtly stated in the SAGs, but you are expected to have some knowledge of this. So it is the concept of amniocentesis and chorionic villus sampling. So amniotic fluid, as you know, is the fluid that surrounds an embryo or later on a fetus during pregnancy. And amniocentesis is a procedure in which amniotic fluid is removed from the uterus for testing. And amniotic fluid contains various proteins secreted by the embryo or fetus, as well as cells that have sloughed off, in other words, flaked off the actual embryo or fetus. And what happens is those cells and or that protein, those proteins, are then analyzed in various different ways to determine whether there is anything wrong with the embryo or fetus. So let's have a look at how it's done, and then we'll talk about the actual testing. So in amniocentesis, what happens is, while watching on a video screen on a monitor, and while using the ultrasound to show on the monitor what is going on. So remember that this ultrasound on the monitor would show exactly the position of the embryo or the fetus. I'm just going to say embryo, and the position of the needle and the position of the placenta, etc., to ensure that no damage is done to the embryo. So a needle is pushed through the abdominal surface, through the muscle layers and the wall of the uterus, through the amniotic sac and into the amniotic fluid. And then some amniotic fluid is extracted. That amniotic fluid is then tested in various different ways to determine if there's anything wrong with the embryo. So, and remember, blue, you don't have to learn. So there are a variety of different kinds of human cells in the amniotic fluid, and they're shed from both the embryo and extra embryonic tissues. In other words, those membranes that I spoke about in the section on the placenta and the umbilical cord, they are outside the embryo, so extra embryonic, but they are produced by the embryo. So genetically, these cells and the proteins that are in the amniotic fluid can give some indication of various aspects of the embryo. In addition, there are also certain proteins produced by the embryo, some of which are able to pass into the amniotic fluid from the umbilical cord. There's also fetal urine, something called meconium, which is, we'll talk about later, hopefully, and other fetal secretions, some that pass through the fetal skin. So they are all in that amniotic fluid. So why is the ultrasound scan used? It uses high-frequency sound waves to produce an image of the uterus that is relayed to a monitor. And that allows the person doing the amniocentesis to check the position of the fetus or embryo to find the best place to remove some amniotic fluid and to ensure that the needle can pass safely through the walls of the abdomen and the uterus and not cause any damage. So why would a person have amniocentesis? So first thing is genetic testing. So this involves taking a sample of the amniotic fluid, culturing the cells, and then testing or examining those cells for certain conditions such as Down syndrome. So this would be especially recommended for women falling pregnant if they're over the age of 35 years. So then what they would do is they would get the cells to divide and they would produce a karyotype of the chromosomes in the cells. And the experts would be able to say this individual has Down syndrome. And then the parents can be offered all the various options. So they can be told that the options are things like to have an abortion, or if they keep the child, what some of the advantages and some of the disadvantages are. So it's just so that a couple is prepared for the future. Or they can be tested in other ways, and this wouldn't be seen on a karyotype, but they can be used to determine something like a genetic condition such as Tay-Sachs. So if both partners of the couple are carriers of Tay-Sachs, but because it's a recessive gene, don't show that they have Tay-Sachs, but they know that they are both carriers, then there's a 25% chance that any child that they have would have Tay-Sachs. Now, we'll talk about this when we get onto the section on genetics, but it's an absolutely heartbreaking condition where within 2 to 3 years, the child has deteriorated so badly that very few children with Tay-Sachs survive longer than 2 or 3 years. And so many people would prefer not to actually have a child if it does have Tay-Sachs. Also, it's possible to diagnose a fetal infection. So it can be used to see whether a child has an infection or an illness. And it can also be done to evaluate the severity of something like anemia. And this is to do with whether or not the baby has RH sensitization. In other words, you know, we've spoken about the fact the mother might have a different blood group to the baby, the embryo, and that can cause a response where the mother produces antibodies that cross the placenta and actually go into the embryo and cause harm to the embryo. All right, so this then would be the type of karyotype that would be produced if the baby were a female. We've spoken about that. And this particular female has trisomy 21, in other words, Down syndrome. Now, remember that Downs can be Downs with the apostrophe S, which is the correct thing, or now commonly Downs with no apostrophe, or the Americans even say Down syndrome. Okay. They also can test whether the fetal lung maturity, this will show whether the baby's lungs are mature enough to be able to, for the baby to be born. So if they want to say, there's a particular situation where they want to induce the baby to be born earlier than the due date, or they want to do a Caesar earlier than the due date. It's not a good thing to do this if the lungs are not well enough developed for the embryo of the baby to survive. And so they can test using amniotic fluid. Paternity testing, so amniocentesis can collect DNA from the fetus, which can then be compared to DNA from the potential father to determine paternity. Okay. And then also for treatment, it's possible for too much amniotic fluid to accumulate during pregnancy. And so then they would do amniocentesis to drain excess amniotic fluid. So when I spoke about the proteins that might be present, certain studies can be done directly on the amniotic fluid, including measurement of a particular kind of protein. So this one is alpha-fetoprotein. And this is a marker, it's an indicator that the fetus actually has a neurological abnormality. So there's a condition called spina bifida, which you probably learned about when you were in grade 10, where the neural canal of the vertebrae don't close completely. So if you look at these vertebrae here in the vertebral column, what you can see is the neural canal didn't close completely, and so the spinal cord actually protrudes out from the vertebral column, and it forms this little protrusion here, covered by skin and very little else. And it's quite a complex situation. And it's possible to test for spina bifida by testing for this particular protein. Okay. So I've described amniocentesis to you. I just included this particular one because it's possible to see here on the monitor in the background the position of the embryo and where the needle is relative to the embryo in the uterus. Okay. So I've spoken about that. So what they can do is draw out amniotic fluid. They can centrifuge the fluid to separate the cells from the fluid. They can then culture the cells. They can look at the chemicals that are in the fluid. They can do a DNA analysis to say, test for Tay-Sachs, or they can do a chromosomal analysis to test for Down syndrome, for example. Okay, this shows you the monitor very clearly. So amniocentesis is usually only performed between 14 and 20 weeks, although certain medical facilities are very skilled in this and they can do it as early as 11 weeks. But even if parents are concerned, generally the experts won't do it before 14 weeks. Okay. So there is a little bit of risk due to amniocentesis that the mother will have a miscarriage. It is said to be low, but as a certain percentage of women in any case will end up miscarrying in their second trimester. Now remember that if one looks at a pregnancy, the duration of a pregnancy is divided into 3 what are called trimesters, sort of equal in length. And certain number of women will miscarry during their second trimester anyway. So if they have an amniocentesis and then have a miscarriage, it's not certain whether the miscarriage was caused by the amniocentesis or not. So it's quite difficult to come up with an exact figure as to the risk of miscarriage from amniocentesis. But according to the American College of Obstetricians and Gynecologists, the rate from the procedure is as low as 1 in 300 to 1 in 500, perhaps even lower if the doctor or the center has a lot of experience. But research suggests that the risk of pregnancy loss, in other words, miscarriage, is higher for amniocentesis done before 15 weeks of pregnancy, which is why they tend to not do it so early. So what are some of the other risks? Leaking amniotic fluid. So rarely amniotic fluid leaks into the vagina after amniocentesis. However, in most cases, the volume of fluid lost is very low and it stops within 1 week and the pregnancy is likely to continue normally. It's possible to have a needle injury. So the embryo or fetus might move an arm or a leg into the path of the needle. Serious needle injuries are apparently rare, however. And very rarely, amniocentesis might trigger a uterine infection. So you're happy about amniocentesis, I hope. You know the pros, you know the cons, you know the reasons why it happens, and you know how it happens. An alternative method of coming up with the same test results is a process called chorionic villus sampling, which has some pluses and it has some minuses, and certain people prefer it over and above amniocentesis. So let's have a look. So in this case, what happens is a small sample of cells is removed from the chorionic villi. So remember that the chorionic villi are produced from the chorion. And remember that the chorion is an extra embryonic membrane produced by the embryo. So this is embryo tissue. So they use an ultrasound scan for guidance, just as they did for an amniocentesis. And then they use one of two different methods to get the cells. But what they're doing is they're actually getting cells. They're not getting fluid. So the first way in which they can do this is called transabdominal chorionic villus sampling, where a needle is inserted through the abdominal wall. And this is the most common method used. And it is guided into the chorion, into the chorionic villi of the placenta, and then it just aspirates or sucks out some of the cells there. Or there's a method called a transcervical chorionic villus sample, where a small tube or a small forceps is inserted through the cervix into the uterus, and some cells are aspirated in that way. This is one of the pluses. It can be carried out earlier than amniocentesis. So if a couple is concerned, it's an advantage to actually have chorionic villus sampling done, in that it can be done earlier than amniocentesis. So it's usually carried out between the 11th and the 14th week of pregnancy, but sometimes later than this if necessary. Okay, so here are the two different methods. I said to you that the one is a needle passed through the amnion, just like amniocentesis, and it goes into the placenta. This needle's thousands of miles away from the placenta. Okay, and it goes into the placenta and they suck out some chorionic villi. All right. In this one, a tube is inserted through the vagina, through the cervix, and into the placenta, and sucks out some cells of the chorionic villus. It collects larger samples. It provides faster results than amniocentesis. And so it may take between 1 and 7 days, which is much faster than amniocentesis results. Because remember, in amniocentesis, they need to culture the cells. And here they're actually getting the cells out directly. But it will result in exactly the same information as an amniocentesis. Okay, it's just a different method of doing it. So this then shows you that what they will do is they will get fetal cells in both cases. They can do biochemical tests where they test the proteins or the chemicals that are in the fluid, or they can test how the cells are responding, or after several weeks using amniocentesis, they can come up with a karyotype. In the case of chorionic villus sampling, it's several hours, and they can even get the biochemical test results within several hours. So that's the benefit of chorionic villus sampling, a much shorter waiting period. However, it's often estimated that the risk of miscarriage from chorionic villus sampling is between 1 in 100 and 1 in 200. And so that's higher than the usual estimates for amniocentesis, almost twice as high. But there's no real consensus on the actual risk of miscarriage due to CVS. One of the centers that does a lot of chorionic villus sampling in the United States published a paper saying that they had found their miscarriage rate was down to about 1 in 360. And that was similar to the center's miscarriage rate from amniocentesis. And they attributed it to improvements in ultrasound imaging and the doctor's increased experience in doing chorionic villus sampling. So if the two rates are similar, then the benefits of chorionic villus sampling outweigh the benefits of amniocentesis, because remember, much faster results, and it can be done earlier. Okay, right, that's the end of that one. I wouldn't learn the process obsessively, the two processes. I think I would have knowledge of it and know about the pluses and minuses of each of them. Okay.